Hello everyone, welcome back to the channel. Today we're diving into a topic that's going to be important for nursing students as well as practicing nurses, and it's understanding the key differences between arterial and venous insufficiency. These two conditions, though they might seem a little bit similar at first, understanding and knowing how to differentiate between the two is going to be very vital when providing the right care for patients. So we'll be breaking down the signs and the symptoms so that you're confident and comfortable in not only your assessment but your interventions. Let's get into it. So arterial insufficiency occurs when there is a reduced blood flow through the arteries, often due to narrowing or blockages. Some of the common causes include atherosclerosis, thromboembolism, or trauma to the arteries. When we're looking at assessing for signs and symptoms of arterial insufficiency, some of the points that you want to think about is the pulse, the temperature of the skin, the color of the skin. Are there signs and symptoms that are based on the position of that extremity? If you auscultate, what do you hear? The extremity pain, how do they describe it? And also the location of ulcers or sores. So in arterial insufficiency, what you'll find is either diminished pulses, weak pulses, or in critical cases, absent peripheral pulses. There is also the absence of drainage, right? So in arterial insufficiency, there's often no drainage from the ulcers or the wounds because of the lack of adequate blood flow to the affected area. There's no drainage because there's poor blood supply to the tissues, as well as these ulcers that are associated with arterial insufficiency really tend to be dry with minimal to no drainage. The tissue around the ulcers often become necrotic due to the lack of blood supply, leading to a dry and often blackened appearance. Now, in arterial insufficiency, what you'll find is that the extremity that is affected is often pale and cool. In addition, you'll find that there's pallor when the extremity is elevated. And this is because gravity makes it harder for that already compromised artery to deliver blood flow to the tissues. So the reduced blood flow then results in a pale or whitish color to the skin, and that is what we describe as pallor. This happens because there isn't enough oxygen-rich blood reaching to the areas in order to maintain a normal and healthy skin tone. Now on the right, that shows rubor when dependent or not elevated. And this is because when the limb is placed in a dependent position, so it's lowered, gravity helps blood flow back into the affected area. But because due to arterial insufficiency, the blood pools in the area is often deoxygenated. This pooling of poorly oxygenated blood causes that reddish blue or deep red color in the skin known as rubor. And again, that's the image on the right. A bird is an abnormal swishing sound that's heard over a blood vessel, usually by using a stethoscope, and it's often present in arterial insufficiency. It occurs when there is turbulent blood flow within an artery, and the turbulence is usually caused by partial obstruction or narrowing of the artery, leading to irregular flow of blood. Now, a bruit's present and it's auscultated with a partial occlusion, and then no bruit is present with a complete occlusion. This is how it sounds. So the next thing we'll discuss is pain. In arterial insufficiency, pain can occur both during activity and at rest due to the inadequate blood flow to the tissues. And here's why. Patients will sometimes have pain at rest, and this is often due to severe ischemia and also tissue necrosis. Rest pain, it's more severe form of pain, and it occurs when the patient is not even engaging in any physical activity. And it often worsens at night when the legs are elevated. Why does it happen? Now, as the artery insufficiency progresses, the blood supply becomes so limited that even low oxygen demands of resting tissues cannot be met. This chronic lack of oxygen, ischemia, leads to consistent pain even without physical exertion. Patients sometimes report that their pain is worse during the night. And this is often because you're lying down, there's no gravity assisting that blood flow to the lower extremities. And this does further reduces the already compromised blood supply. Patients will also report that they do find relief when they dangle their legs off the side of the bed. And this is because gravity is helped and it improves blood flow. Now, pain at rest is a sign of more advanced arterial disease, and it also indicates that the tissue is not receiving adequate blood supply even under minimal demands. It is a very important and critical sign of worsening ischemia and could also precede more serious complications of arterial insufficiency, such as ulcers and gangrene. Patients may also report pain with activity that resolves with rest. And this is what is called intermittent claudication, and it happens during physical activity such as walking, dancing, exercising. So during activity, muscles require more oxygen to function. In arterial insufficiency, the narrowed or blocked arteries cannot deliver enough oxygen-rich blood to meet the increased demands of the muscles. So as a result, the muscles begin to suffer from ischemia, leading to cramping, aching, typically in the legs. Patients will report pain to their calf, their thighs, and even their buttocks, depending on where the arteries are affected. In arterial insufficiency, the location and appearance of ulcers or sores is closely linked to the underlying issues of poor blood flow and tissue ischemia. Sores are often located on the toes and feet. The toes and feet are the most distal parts of the body. They're furthest from the heart, and in cases of arterial insufficiency, blood flow is compromised, especially to these distant areas. So as a result, these regions are more prone to ischemia and tissue breakdown. As well as because of the arterial narrowing or blockages, the blood supply to the toes and feet is significantly reduced. So patients are more susceptible to developing ulcers as they receive less oxygen and nutrients necessary for tissue repair and maintenance. Another thing to think about is that our feet and toes really endure significant pressure and friction from activities like walking and even wearing shoes. In the presence of poor blood supply, even minor injuries, a scrape, a scratch, pressure points, or rubbing can quickly lead to the development of ulcers because the tissue does not have adequate circulation to heal properly. Another thing to think about is your extremities are also more exposed to temperature changes, and cold can further reduce blood flow, exacerbating the risk of ulcer formation in these areas. Arterial ulcers are often round and smooth. Now, in arterial insufficiency, the ulcers are primarily caused by ischemia, where there is tissue death due to lack of oxygen. This process tends to create well demarcated, round, smooth-edged ulcers because the tissue necrosis occurs in a more uniformed manner rather than being caused by irregular trauma or pressure. There's also lack of granulation tissue. The poor blood supply prevents the formation of granulation tissue, which is essential in wound healing. Without granulation tissue, the edges of the ulcer remain smooth and well defined. The ulcer itself does not heal quickly or fill in with new tissue, contributing to that appearance. The smooth round edges of arterial ulcers are often described as punched out because they tend to have a sharply defined border with a clean, uniform shape. And we rarely see that this is very different from venous ulcers, which usually have irregular borders, a more uneven surface due to the underlying mechanisms. Other findings that you'll be able to assess in arterial insufficiency include thin, dry, scaly skin, thick toenails, hairless, shiny skin, as well as muscle atrophy to that extremity. The image below is an example of a patient that has arterial insufficiency. They also have a more advanced disease. And on the right, you'll notice the dependent rubra. And then on the left, you'll realize the elevation paler. And this really results from that impaired autoregulation in the dermal arterioles and capillaries. Now that we've covered arterial insufficiency, let's shift our focus to venous insufficiency, another yet distinct vascular condition. Unlike arterial insufficiency, where blood flow to the extremities is reduced, venous insufficiency occurs when the veins in the legs have trouble sending blood back to the heart. And this leads to a wide range of symptoms, which we will explore in the next few slides. Understanding venous insufficiency is going to be very important when you're trying to not only assess but manage the unique challenges that patients who do have venous insufficiency present. Again, venous insufficiency is a condition where the veins in the leg are unable to effectively return blood to the heart. This dysfunction is often due to damaged or weakened vein valves, leading to pooling of the blood and also increased pressure in the veins. Venous insufficiency can result in different symptoms, such as localized pain, temperature changes, a change in the color of the skin, swelling, changes in skin texture, as well as the location of the non-healing wounds or ulcers that do come about. In venous insufficiency, there's often edema and drainage, and they both occur because the veins are unable to effectively return blood to the heart. With impaired venous return, blood and fluid accumulate in the lower extremities due to the increased venous pressure. The excess fluids leak into interstitial spaces, leading to swelling or edema in the legs, ankles, and feet. Prolonged standing or sitting also exacerbates venous insufficiency because gravity further impairs the return of blood to the heart. This thus worsens edema as fluid continues to pool in the lower extremities. Increased capillary pressure also happens because the elevated venous pressure leads to increased capillary pressure, which then forces more fluid out of the capillaries and into surrounding tissues, contributing to swelling and edema. And as I said, as the veins are unable to properly return blood back to the heart, they pool in the extremities, and because there's pressure, they leak out of the blood vessels into surrounding tissues and leads to drainage from ulcers or wounds. Discoloration in venous insufficiency is primarily due to the effects of increased venous pressure and the resulting chronic changes in the skin and underlying tissues. And here's why. Prolonged increased pressure in the veins lead to the breakdown or leakage of blood components into surrounding tissues. The breakdown of red blood cells in these tissues releases pigments such as iron storage pigment, which causes a brownish or reddish discoloration of the skin, and this is known as hemosiderin staining. The stagnant blood and increased pressure contributes to chronic inflammation. This inflammation can cause changes in skin pigmentation, making the skin appear darker or discolored, and particularly around the ankles and lower legs. Another reason is because of the high venous pressure causing the capillaries to leak fluids and blood cells, and over time the leakage contributes to the brownish or reddish discoloration, and particularly in areas of chronic edema and ulceration. Some other symptoms are skin is warm, it's thick, tough skin, and as I mentioned, that browny color, so that reddish brown color, and it's also sometimes cyanotic, mottled, or pale. This image is an example of a patient who does have venous insufficiency, and you can see that browny discoloration, particularly around their ankles and lower legs. You also see those irregular shaped ulcers and also the edema, the swelling. Patients will often sometimes report moderate pain, and it's localized to the area of inflammation, and they describe it as a dull, achy pain. You'll also see the sores that's mentioned near the ankle area, and the sores also have irregular borders. This image is an example of a patient who has chronic venous insufficiency, and you'll notice the discoloration, that brownish reddish look. You'll see the edema around their ankles as well as their lower legs. The skin also looks a little bit flaky, and it also has that leathery looking skin on their legs, and they also have a few ulcers. Some symptoms of chronic venous insufficiency include swelling in the lower legs, new varicose veins, aching or tiredness in the legs, leathery looking skin, flaking or itching of the skin, and also stasis of ulcers. And this is another example, and you can see those varicose veins even in their thighs. You'll see that discoloration and also the edema. This is another example of a patient that has chronic venous insufficiency, and that brownish reddish discoloration is really pronounced here. Thank you for joining me in exploring the key differences between arterial insufficiency and venous insufficiency. Understanding the differences in their signs and symptoms are very important in providing effective care for patients, identifying and even improving our assessment skills. If you found this video helpful, please like and subscribe for more content on nursing and healthcare topics. And also feel free to leave any questions, suggestions, or comment below. Until next time, KGS Nursing Ed.